Hello friends, today I am going to speak about inpatient housing systems in any given hospital. Over the years, inpatient rooms have become more like where you reside, so they are trying to make rooms as close to what you experience at your home. That's a sea change from the old Florence Nightingale type of wards, which were more military in the outlook, strict white colors, strict white beds and bed sheets. All that is now changing and changing very rapidly, where you will see it's coming more and more closer to what would be your room in your home or a room in a hotel. The first thing that has to be considered is the number of beds in each category of room. So you have general wards, you have twin rooms, you have single rooms, you have suite rooms, then you have category of intensive care beds, and then there are some specialized areas like pediatric wards. There are burns units, and there are long term care units, and there are assisted living units, and like that. Any inpatient floor or zone will have 4 or 5 typical subsets which you need to take care. So one is the patient zone, which is the patient room itself, in area around the patient. Then there is a relative zone where you need to provide for the relatives in terms of a couch, in terms of cupboards for storing things, because the relative also would stay as far as the average length of stay of the patient goes. Then there is a service zone, which is to do with utilities like toilets, pantries, the corridors, the dirty utility rooms where we wash the bedpans and other things. There are clean utility rooms where we have to store the linen. There may be in terms where you have general wards. You may probably want to have a treatment room, so that you don't want to make dressings or minor procedures to be done on bedside. You might shift the patient to the treatment room. So these all, when you categorize, come into the service zone. Then there is the staff zone of an inpatient unit, which is the nursing station itself, which should have properly laid out counters. They should have computer systems. Many of the things now are becoming paperless, where you indent directly from the nurse stations. Even billing has a lot of entries that are made from the nursing station. Apart from that, there should be proper storage system for filing, because each patient file probably should be given one slot. Diagnostic reports should be properly stored or stacked. So all this should be taken care of when you, because this is a very high traffic zone, and there are a lot of nurses, ward boys, resident doctors, even consultants who work in this area. This area will also need to have some staff rooms, so resting place for nurses. There will be some medical preparation areas. There would be a separate staff toilet here. If it's a high intensive zone, then you might need a resident doctor room, to also come into this zone. So this is, broadly speaking, the 4 types of zones that every IPD floor would have. Apart from this, there would be certain areas that you need to earmark, which is the janitor's closet, specific area for storing or keeping wheelchairs and stretchers. Then comes certain inpatient rooms which are like pediatrics. So you might like to add into it, make it more colorful. You would like a play area there. The inpatient room itself should be designed with the pediatric age in mind. So the bed should be smaller. The toilet should have WCs and wash basins at heights which a child can access. The room also generally is designed for 1.5 a person, so it's going to be a parent who is always going to accompany the child. So you would need to design it in a particular manner. Apart from this, there are then critical zones. So intensive care in itself is a very specialized area. But amongst those, there are burns wards, which we need to plan. And one of the critical things in burns is that you need to have high, almost 100% fresh air going through, because it's more ventilation which is required rather than cold air. So, and if the air is not ventilated fast, there are chances of infection in the patient, because the patient's body generally is exposed. You can't cover it because there are burns. So you have a net around the bed and the patient's body is exposed. So this is something which is a little bit specific for them. In critical care, inpatient housing system, the key is ingress of window, light from the window, because these patients otherwise would go into a state of ICU psychosis. They might lose the track of time. If they don't see natural light, they would come in from post anesthesia, recover in darkness, and they won't understand whether it is day or night, which will create all kinds of problems for them in terms of their bowel movements as well. So for intensive care, it is a must. It is a must to have natural light ingress as much as possible. There should be, nowadays most hospitals provide for dormitories for each intensive care unit. The relative has a bed. So if there are 20 ICU beds, there will be 20 beds in the dormitory for the relative to stay, so that they are more comfortable. So today's inpatient housing system is not only all about patients, but also about their relatives. And this would get even more importance if you have a gynae maternity where the fathers need to be taken care of. Little bit about technology, for inpatient rooms of future. So there are a lot of things that you need to take care of. The size of the door. Nowadays you take the bed in and out. You don't move the patient on a stretcher and back on the bed. So door width has to be proper. There should be guardrails as far as possible for the patient to move around. Beds themselves are coming into various categories now, where you can lower the bed, electronic control in hand of the patient. Nurse call systems now are made in a manner that how you have in the airline, when you push a button, someone has to come and switch it off, and both the time will get locked, so that the serviceability of the patient improves. Most of the lights that you see, nothing should be on the ceiling. There should be diffuse lights coming from around the bed. You have various sleek systems now which are coming in terms of the hidden system of a patient, plug points, gases and suction and all of that. So those things can be done. There are pneumatic chute systems which are now there from the nurse stations. The samples will directly transferred to the laboratory. So every nurse station probably should have that kind of a pneumatic tube station. Then within that, all toilets in inpatient rooms should be having doors which open outward, and at least one room on every floor should have wheelchair accessibility going inside the washroom. And inside the washroom you need grab bars, you need panic buttons, so that if a patient has a fall, he can raise the alarm and someone can attend to him. There should be very clear segregation of the wet area where you shower and the dry area, which is WC and the wash basin, so that there is no spillage of water, which goes out of the thing. Nowadays we have soft floorings which have come out, and even in the washrooms you can use soft floorings, so that there is a less hurt if a patient falls down. You could look for mixers in terms of basins, that you need hot and cold water. So there are many things which are now coming in this inpatient room area. One of the hospitals we designed, Asian Art Hospital in Mumbai, we have created a day area, which is specifically meant for relatives to go and sit down and watch TV or make phone calls, or they have workstations where they can do their office work while their patient is resting. So these kinds of areas which are breakout areas are also gaining popularity. One of the hospitals like Kokilaben Dhirubhai Ambani Hospital even has a green organic food cafeteria sandwiched between inpatient floors. So it's not only about the patient, but it's also about the relatives that you need to cater for in today's inpatient rooms. So you think out of the box when you are today designing inpatient rooms.